Hello everyone, and welcome back to Okiraku-Radiology. Let's take a look at today's case. I'll start by scrolling through the images quickly. So, were you able to identify where the lesion is this time? If you'd like to scroll through the images on your own, just like in the clinical setting, check out the trial linked in the description. Let's interpret the images together. The area to focus on in today's study is right here. See this long worm-like structure? Do you recognize it? Yes, that's the appendix. In these images, the appendix is inflamed, giving us appendicitis. It's a disease that commonly occurs in children. So, what exactly is appendicitis? I'll explain while we look at the illustration. The appendix is a slender, worm-like organ that dangles near the junction where the small intestine transitions to the large intestine in the right lower abdomen. The localized area just below this transition point is called the cecum. The structure hanging from the cecum is the appendix, and when it becomes inflamed, we refer to it as appendicitis. Appendicitis arises when bacteria proliferate inside the appendiceal lumen. Most often, stool or fecaliths clog the narrow opening of the appendix, bacteria multiply inside, blood flow stagnates, oxygen supply drops, the cells weaken, and these factors combined trigger inflammation. The imaging signs reflecting this inflammation include the swollen, enlarged appendix and the fuzzy white haziness around it. Let's examine the appendix carefully. First, look at its size. We'll compare it later to a normal appendix, but under normal conditions, the non-inflamed appendix is nowhere near this conspicuous. In these images, the appendix looks almost like small bowel because it's swollen by inflammation. One common criterion is an appendiceal diameter of 6 millimeters or more, which suggests appendicitis. Next, inspect the appendiceal wall. The appendix is a hollow viscus, so like any part of the intestine, it has a wall and a lumen, similar to a hose. Here, the appendix has become swollen overall because of inflammation, and at the same time, the wall itself is thickened. Inside the appendix, you see a grayish density, which is fluid, such as digestive secretions. On CT, fat appears black, bone appears white, and water is somewhere in between. So this gray tone tells us the lumen is filled with water-like fluid. If gas were trapped inside, the lumen would look black. By contrast, the appendiceal wall consists of tissue, mucosa, muscle, and so on, so regardless of the luminal contents, it's a soft tissue structure. When appendicitis develops, the appendix becomes enlarged and the wall thickens. In this image, you can clearly see the appendiceal wall thickened by the inflammation. Now look at the surroundings. The fat around the appendix has a fluffy white stranding. Normally, this is an area of visceral fat that appears jet black on CT, but around the appendix it looks grayish. That happens because inflammatory exudate, essentially water, accumulates, and because blood flow increases to deliver cells needed to tissue repair and fight the invading bacteria. This makes the fat look whiter and more conspicuous. Let's compare the diseased appendix with a normal one. Can you pick out the appendix without appendicitis? The answer is this tiny structure here. That's a normal appendix. It varies from person to person, but a non-inflamed appendix is very small. The wall doesn't thicken either. Now check the two cases in the coronal plane, view from the front. On the appendicitis image, the enlarged appendix is easy to see, and you can clearly trace its course. In the normal image, the appendix is this slender structure here. Because it hasn't enlarged, it's a bit harder to spot, but that's the appendix. Comparing them side by side makes it clear how dramatically the inflamed appendix swells up. Now let's level up a bit. Identifying appendicitis is excellent, but let's search for additional secondary findings. Is there ascites? Down in the pelvic cul-de-sac, this area looks like ascites. It's only a small amount, so the clinical significance may be limited, but some free fluid is possible. Ascites can indicate peritoneal irritation or even peritonitis, so the presence of fluid often correlates with more severe disease. Inflammation can also make lymph nodes react and enlarge. How are the nodes here? Near the inflamed appendix, particularly along the superior mesenteric chain, you can see several lymph nodes that are slightly enlarged. Normally, they wouldn't be this prominent, so these immune-related nodes are reacting and swollen. Another crucial assessment when you find appendicitis is whether there's perforation. Perforation means the appendix ruptures or develops a hole, as shown in the illustration. If the inflammation becomes excessively severe, the wall can necrose and rupture, letting gas escape, forming a large abscess filled with pus, worsening the inflammation and potentially leading to peritonitis. To determine if perforation is present, we assess for discontinuity of the wall, the presence of free air, and any abscess formation. First, let's evaluate wall continuity. We need to inspect carefully using thin slices. Tracing the appendiceal wall, there's no evidence of interruption or rupture. The wall remains intact. We're using contrast, so the appendiceal wall enhances in white. There are no areas where the enhancement disappears. If an area fails to enhance, that suggests the blood supply is cut off and necrosis is likely, but we don't see that here. Next, is there any free air? Free air refers to gas that escapes into the peritoneal cavity when bowel ruptures. Air appears black, so if there were free air, we'd see abnormal black pockets outside the intestine, but a quick survey shows none. Lastly, is there an abscess? An abscess is a collection of pus. When bowel necrosis leads to rupture, bacteria like E. coli spill out and form pus, so an abscess often indicates perforation. In this case, there's no abscess. Let's also review the coronal images viewed from the front. The appendix is markedly swollen, the wall is thick, and the surrounding visceral fat is shaggy and white, confirming appendicitis. Looking closely at the thickened wall, there's no discontinuity or hole and no loss of contrast enhancement that would signal necrosis. There's no abnormal air around the appendix, all the gas is confined within the small and large intestines, so there's no sign of leakage. There's also no large collection of pus suggestive of an abscess. Therefore, this is appendicitis without perforation, a simpler form of the disease. How is that? This is the approach to reading appendicitis on imaging. Introducing Okiraku Scroll Viewer. Have you ever wanted to scroll through the scans yourself while watching imaging videos? Once you hear the answer, it sounds easy, but when you try to interpret the images on your own, it can be quite challenging. Still, if you form your own differential and then check the answer, your reading skills improve dramatically. Watching someone else scroll makes it hard to read. That's why we created Okiraku Scroll Viewer, a specialized training site for imaging interpretation. Just like in a real clinical setting, you can scroll through the images freely. It includes various cases and their answers. By scrolling yourself, making your own diagnosis, and then checking the answer before reviewing the images again, you're guaranteed to get better at reading scans. If you're interested, please jump to the link in the description and try scrolling for yourself. You can use it on both your phone and your computer. See you in the next case. Until then.